Dolpa is one of the most remote part of Nepal because it is not connected with the road network. The district has more than 35,000 of population and only one doctor staying in district hospital. And this is the reason why the people in Dolpa, they don't get good health services, and we are there for making health camp because people will get doctors in their one place. Chay-Ya is working in a mountain region, and it's basically serving people for the health and educational development in a remote area of Nepal. The main purpose of our health camp to Dolpa is first to give immediate medical support to the villagers who are really needed it, and second is to explore the possible plan for our project. Like it can be the livelihood project or the health project or the educational project. So this gives us idea what is the most important thing to be done in that region.
Already 9 years ago, I was on the way to a very remote place called Tsum Valley. That's a 6 or 7 days walk up in the Himalayas. And we were trying to find a strategy for sustainable poverty reduction. And then when I came there, suddenly out of the tent in the morning, there were lots of people, 60 or 70, who gave me their children in their hands, their sick kids, And they had no medicines, no doctor, no nurses, nothing. And I just knew if I'm not going to do anything, no one's going to do something there. So that's why I started Chay-Ya, because Chay-Ya is Tibetan language and it means let's do it.
I'm joining the health camps in remote areas. First, I'm from village remote area where there is no, the oral hygiene awareness about that. So I just want to visit each village to convince, to motivate and to educate the patients to the importance of oral hygiene. Last health camp with Dolpa, as compared to the previous year, this time was a little bit better. When you go remote area, it's much worse because they don't have any knowledge and awareness about the oral hygiene. So that's why people don't have brush and toothpaste. They didn't brush at all.
The people in Dolpa, they presented with a lot of different issues. There were many things that we expected, like malnourishment, dehydration, high blood pressure, joint pain, upper respiratory tract infections, but also a lot of things that we didn't expect at all. There were some suspected cases of tuberculosis, there were severe skin infections, there was very, very bad wound management with a lot of infections, and to our surprise we also found out that sexually transmitted diseases seem to be widespread in the Dolpa region. A very moving example related to the topic of wound management was when we met a boy. He had some really minor trauma on the hand and very bad wound management, and we met him with a severe infection. We had to send him to the hospital immediately, and they even had to take off one of his fingers, to amputate one of his fingers, but at least they could save his life.
It's been 5 years I've been going up to Chung with Chay-Ya. People might ask, why do you go there so many times? I relate to the first time I went there, when people told me I was a doctor there after 7 years. That made me realize the gravity of the situation. The healthcare was not nominal, it was just absent up there. And in the subsequent years, as we kept going there, started seeing change. The minor ailments started disappearing just in terms of sanitation. Better healthcare, not coming just from us, but from a habit we're able to form when we're there just for 2 weeks. That led to a positive change. And now what we're looking forward to is a healthcare round the year. With this health post, you have been with us so far, so long, so good. Be with us and help us get there.
I had the good fortune to run into a Chay-Ya health camp that was being run up in the Tsum Valley some 3 years ago. And
so let's go back.
I've had some history in medical services, and I was very impressed with Chay-Ya's ability to provide compassionate and broad spectrum medical care to the most needy of people. Chay-Ya continues to do that, has done that each and every year for the past 3 years, sometimes multiple health camps, and is now well on its way to building a permanent health station in the Sum Valley so that the very deserving people of Sum Valley can have year-round health care. I'm very proud to be associated with Chay-Ya.